one part of organ problem, actually you cannot find a total prevention because the allergy symptom will change, will shift to the other organ, such as one started from eczema, but gradually then get up and grows up until 4 or 5 years of age will become asthma. Right. So this is the allergy. So the typical evolution for allergic disease was started beginning very young and smaller than 1 year of age. They already have a so-called allergy symptom of food allergy and skin allergy. Then we will gradually develop become asthma and allergic rhinitis. And even with the severity, also you can see and during the first years of age and below 3 years of age, and the skin GI symptom that will cause the allergy. And after 3 years, that become respiratory symptom that will cause this child to become more allergy and more severe. And how come we will emphasize for all these symptoms that have to relate with the allergy? Because they have a very good study conducted in the European country. And then they found it is a long-term follow-up until before the 30 years of age, that is before puberty. If the child have the allergy symptom, they will continue for asthma. But if they don't have any so-called atopic symptom, such as the skin allergy or the IgE is become lower, and then not sensitive to the air form or food allergy. And after 3 years of age, the symptom and then for asthma will become gradually comes down. So this is one of the very important factors that determines for the long-term childhood asthma, that is the depend on zero sensitization period or the atopic symptoms in their child in the young childhood. So if you consider for the whole symptom and for the development of allergy syndrome, so firstly, before 1 year and even very young, the food sensitivity will go higher, and then gradually goes up and comes down, and then the other inherent sensitivity, such as like allergy and asthma, they will all become more prominent. So this is a continuous process. And then if we discuss how come our child will become allergic, or how come our child will become asthma, you have to think about the 3 factors. One is the genetic factor, the other our ecological development, but I think the most important thing is our change for the environmental factor. Because during these 30 years, we have found that has a dramatic increase, 1-4, 2-4 increase for the asthma. If we have just only genetic susceptibility, we cannot explain how come the incidence is so high. Because maybe 30 years ago in Vietnam, you never heard about a child that will become skin allergy or become asthma. But nowadays, every child, they got a cough, and they got a nose symptom, a skin symptom, they'll become allergy. So I think that one of the most important things is our changing for the environmental factor. But we will first discuss about the genetic factor. So this is one of the published in 1980 about if we check for the family history, and the family history, the parent, father and mother, if they don't got any atopic symptom. Atopic means that if the patient already have a several IgE higher than normal, and also sensitized to a certain allergy. And if the parent don't have any atopic, the child will become atopic. It's about general prevalence about childhood. But if one parent got an atopic symptom, the sibling will become 1-4 increase, or 20% will get a chance to become allergic. And both parents have an allergy symptom, then 40%. And if they have a same symptom for asthma, the child will become higher, and also have a 75% of the incident become asthma. If you judge it on this control, you will recognize that maybe allergy is the so-called dominant hereditary factor. We're going to have this kind of very some role. But it's one of the caveat, one of the shortcomings is that father, mother, and the child will live in the same area, same house, same environment. So maybe the environment, the housing, have been polluted a lot of allergy. So this study had one defect that they cannot rule out the environmental factor for asthma. So even for that, so a lot of studies have been shown that both parents have allergy and the child they have an allergy incident also over 30%. So genetic factors definitely have something very in here, for the child become an allergy. But some of the more important thing is I just mentioned for the environment. If the mother become pregnant, so during their inhalation, during their environment, such as they will contact with the bacterial pathogen, or they have used a lot of like milk, shellfish, or even they have used the so-called recently we have found the boric acid or something. They have eat a lot of different kind of cause allergy. Then they have something that will change and also affect the fetus that become allergy. So the factor we still don't know, but this is the environmental factor that cause something that can be hereditary passed down to the next generation. We call this factor is epigenetic. That is the factor that environment by the influenced by the environment. So one of the theories that we were talking about for the environment factor is Th1 and Th2 theory. That is balance, or you can mention that it's a so-called hydrogen hypothesis. One of the hydrogen hypotheses mentioned that they emphasize that if you got no previously have a bacterial dimension, or you live in very high hydrogen space, and so the child don't have any chance to develop Th1 immunity, and they will become a Th2 more immune response. So one of the studies published in Lancet that is conducted by the Japanese researcher, and they found if they have used the delayed hypersensitivity result, and they found they have reverse correlation for their total IgE production, and then they have used this delayed hypersensitivity against the tuberculosis. And we think that this is very interesting that if you have a more Th1 like a delayed hypersensitivity reactive, then it will cause the total IgE to come down. So I will also mention one of the paper article research from Vietnam, and you can see that they conducted a survey in the Hanoi city as compared to the urban side of Dong Minh, and it's very funny that you see the incidence for the asthma is also very high, about 15 to 30 to 15%. But if you compare the two areas, one is the city area, the other for the urban area, and then the urban area will have a more high incidence prevalence for asthma and also reducing doctor diagnosis asthma. And it's very, even for the age area also the same thing. So when this study comes out, it's somewhat against the hydrogen hypothesis. But the other thing is that maybe Dong An is not countryside at all. Maybe they have also very highly developed as a Hanoi. And you can see that maternal history or family history, and if the patient have a family have a tuberculosis, it's also cause more chance for the student and children become diagnosed for asthma. So for this study, we have one or two conclusions is that Vietnam somewhat different from the other countries, that the city and then also the countryside somehow is also well developed, and then also the cause for the asthma to become allergy, and for the children become asthma, maybe they have not just only for the hygiene hypothesis for bacterial infection, some of the factors may be also leading to leading for child to become allergic. So the other study is that also conducted in Hanoi and also by the expertise from the Nottingham. They will try to understand if the parasite infection also will decrease for the allergy disease. So this hypothesis, they have used this hypothesis to conduct using the anti-health drug to find out if they can increase